All right, hello, good morning, good afternoon, good whatever time it is, wherever you're watching this from. Hello, everyone. My name is Alex Sorotsky, and we are here finally for another Talks live stream. We haven't been able to do this for a very long time. I believe it was earlier this year. Excuse me. But we are so excited to kick off another one. And this is particularly exciting for me. This is my very first time co-hosting a Talks with Shelly Clary of the Virginia Poison Center. Shelly, it is so great to connect with you this way. How are things in Virginia today?
They are cold.
I second that. I'm typically in the Seattle area, and it's we don't get snow there too much, but when we do, everything just stops. Everything shuts down. All right, so Shelly, I will pass it on to you to introduce our guest for today.
All right, so we have a rather exciting but alarming topic to talk about today. We're going to discuss the risk of ingesting button batteries, which are those flat disk batteries that you can find in watches, car fobs, and all kinds of tech items that are around your house. With the holidays coming up, we wanted to make sure that this is on your radar. To help us do this, we have a couple of experts joining today. We have Dr. Sasha Kaser, the Associate Medical Director with the Washington Poison Center, and Dr. Shireen Banerjee, right?
Mm-hmm.
Director of the Rocky Mountain Poison Center. Thank you both for joining us today.
Hi, thanks for having us.
In just a small world, folks, Doctors Banerjee and Kaiser used to work together with the Rocky Mountain Poison Center, so it's all come full circle. I was super excited to see you two had connected in the past. All right, so let's see here. A bit of housekeeping before we really dive in. So providing all parts of the internet are talking to each other correctly. Folks, if you ask us a question in the comment section on Facebook or on YouTube, wherever you're watching this, we should be able to see it pop up on our end, and we'll do our best to answer that directly. But if you're watching the recording of this, once it exists on the internet and gets circulated that way, please still feel free to ask any questions in those comment sections, and we will go through and do some follow-up answering as we can. So let's dive into the content. Now, before I worked for the Poison Center, I knew that button batteries existed, but I didn't think much about them. I never realized there was any cause for concern. So let's clear the air a little bit and dive in. So Dr. Banerjee, I'll start with you. What makes button batteries so dangerous, specifically when swallowed?
Yes, that's a great question, and I'm so glad we're talking about it, especially with the holidays coming, and kids are probably going to get toys that contain those little batteries. So it's a great topic to have the week before Christmas. Batteries are when swallowed because they can burn the tissues of the throat and the stomach. And even a battery that somebody thinks is dead is not can have an active current. And so the problem is they can get stuck in, especially children, their throats. They might not even know it's stuck, and that can cause very catastrophic problems if it's left there.
Very good. Dr. Kaser, what signs or symptoms can one look for to know if a battery was swallowed?
Yeah, this is also can be a little bit hard because the patients who tend to have the highest risk for bad outcomes are kids who are under 5. And so the limitation with this is that a lot of times they can't give us a great story about what happened. If we do have a clear history that the patient got into it, then a lot of times what we're looking at are things like some wheezing, some drooling, vomiting, kind of complaining that their throat is bothering them. But it can be a little bit harder to figure out when they're not verbal or they have limited verbal skills. And so when they're less than a year, sometimes this just kind of presents as being irritable and not wanting to eat, not wanting to drink anything, maybe having some tarry, kind of blackish stools. When they're around like the 1 to 4 year old range, sometimes we'll see some fevers with this and feeling like they're coughing a lot and really just kind of drooling and vomiting. And you can still see this too with older kids, and you are still can have risks of having bad outcomes when you're older as well too. It's just a little bit higher risk when you're little because of the way that your anatomy is inside your neck. And so when you're older, one of the benefits is usually there's a story behind it. And so usually we can capture those a little bit sooner because as you'll see as we kind of get through this talk, the time that that's exposed to the tissue is really the highest risk part of this. And so knowing that history beforehand can make a big difference on getting that button battery out.
Thank you. Dr. Banerjee, do they need to seek medical attention or go to the ER immediately, or can they wait to see if it's going to pass on its own?
Great question. They need to go in immediately, and you mean go into an emergency department where they can get an x-ray really quickly. Some people might think, well, I'll just call my pediatrician or call our doctor and see if we can get an appointment. Like Dr. Kaiser mentioned, time is ticking, and that time that the battery's sitting on the throat or in the stomach, it could cause damage. And so immediately get to a healthcare facility so that you can have the child seen right away and get that x-ray done. So the x-ray will show where the battery is. So if it shows that it's indeed stuck in the throat, then they can immediately intervene to get it out as soon as possible. And if they show it's in the stomach, there could be some other decision making. People may elect to let it just pass on its own, or they may retrieve it, but it's up to the physicians taking care of the patient to decide what to do at that point.
Very good. Dr. Kaser, one of the very popular questions. Is it true that you can give someone who has swallowed a button battery honey? And if so, how much and what does it do?
Yeah, this is also kind of an interesting one that's in the last 5-10 years, there's been some research out that has shown that potentially honey can provide some protection against the button battery having the current and causing some of the tissue injury, kind of the caustic injury right there. The times that we recommend this are when the kid is greater than 12 months of age, because we don't want to expose children less than that to honey. And we never want you to delay what you are doing to go stop to the store to go get honey on the way there. We want you to go directly to the ER. But if you happen to have honey at home, one of the things that you can do is you can give them 2 teaspoons or 10 milliliters every 10 minutes until you get to the ER. And once you get to the ER, there are some other medications that they can get. Now, during that time period, we don't want you to give anything else. We don't want you to be giving them water, juice, milk. Really what we're looking at is the honey, and just, again, because of the way that it interacts with that button battery, potentially limits the damage that is going on. And so it's kind of exciting that there's something that we can do, but really, as we've mentioned before, time is really the essence. And so please, please, please don't stop what you're doing to go get the honey. If you have it, you can give it. Otherwise, just come to the ER so we can take care of it. Because really what needs to happen is that battery, if it is located in kind of your neck area, we need to get it out.
Perfect. Thank you. So just to clarify, just to summarize, for if anyone's tuning in right at this exact point, honey can potentially help kind of reduce harm from that, but it should not replace getting to the ER as fast as possible. And one should not have liquids on top of that. Should not have water or juice or milk or anything like that. Is that correct?
Yes, absolutely.
All right, perfect. Now, is there anything else either Drs. Kaiser or Banerjee would like to add to any of those answers so far before we move on to the more specific safety steps?
I think for me, one thing is that sometimes it's not always witnessed that a little one swallowed a battery. And so that makes it really, really hard, because if you don't know what they swallow, then how do you tell the doctor what's going on? So it's really just paying attention, making sure your batteries are kept out of sight, out of reach. If you are changing, getting the little screwdriver and taking it out of the compartment, don't just leave it on the counter, because you may step away and then it's gone and you don't realize that it's gone. And so, it's just a problem when it's not witnessed, because then it's usually a delay till symptoms are present and damage is already done until the child gets in.
Right. Thank you. And anything else you'd like to add, Dr. Kaiser?
I think the only thing that was mentioned earlier is that just because the battery is dead doesn't mean that it can't inflict damage. There can still be a little bit of a current. And so kind of at that same point, even if you are changing out the battery, we don't want it to be visible in the first place. But even though you say, okay, it's probably not a risk because the button battery is dead and it's not working anymore in that device, that doesn't mean that you can't still get damage in the esophagus. So it still is the same risk. It still requires the same thing, where the patient needs to get seen right away in the ER.
Right. Excellent. Thank you both. Oh, I'm sorry. Please continue.
Thanks. The only other thing that I was going to say, and we've emphasized this earlier as well too, is when we tell you to go and get seen, we really do want you to go into the ER. We don't want you to go into an urgent care. And the real reason for that is you need to have an x-ray to say one way or the other, but in order to get to the people who can take it out, you really need to be in an ER setting so that they can get the specialist involved if they do need to take it out. The problem with going to an urgent care is they can potentially get the x-ray, but they may not have the specialists who are able to take it out. So
That's a great clarifier. Thank you so much for that, Dr. Kaiser. Now, a question for you, Dr. Kaiser. Let's shift a little bit toward prevention, so making sure things don't go wrong in the first place if we can. How do we prevent these? How do we prevent these types of ingestions?
yeah, I think a lot of this is just being aware. We have seen a huge surge of button batteries being used in all sorts of different tech devices over the last 15, 20 years. And sometimes just having them available puts us at risk because they are there, we're changing them out, we're using them in a lot of different devices, and they're just the right size where it's easy enough to swallow, but also in a little child, it's easy to get stuck here as well too. And so it just kind of is an unfortunate setup. So really be mindful of what devices have button batteries in them. Don't let your kids play with them. For the devices that you know have button batteries, make sure that you check them routinely to make sure that they are shut so that the kid can't get access to them. Try and avoid letting them play with toys that it's not secured because you don't want them to have accidental exposure to them. Make sure that the extra batteries are stored in a safe place. You know, they're not candy appearance and color, but they're the right size for it. And so a lot of times kids can get confused, and kids like to explore things and they get into things. So make sure that you keep them up high. Try and recycle your batteries as soon as you're done with them. There's places like Home Depot or other stores that have a great recycling program where you can just bring them in and they will dispose of them for you. And then really just recognizing what things in your home use button batteries can make you just more aware so that you can keep yourself safe. The other thing too is sometimes adults will, be changing something and they'll put it in their mouth while they're doing it. Try and avoid doing that because these things are really, really slippery. And as we mentioned before, while we worry a lot about the kids, this can still happen to adults as well too. And so don't be tempted to try and do too many things with too many hands and put it in your mouth while you're moving around, and then all of a sudden it goes in your throat, and that's not a fun way to spend the rest of your day.
Absolutely.
Yes. So, Dr. Banerjee, just to recap, what should we do if we think someone has swallowed a button battery?
So first thing is, if they're having any distress, that would be like a 911 call. So if somebody is choking or visibly in distress, there's no time to make a phone call to the poison center. We would say call 911. But if there is no distress and you think somebody has swallowed it, you witnessed your child swallowing a battery, or you think maybe he or she did, then call your local poison center. So that 1-800-222-1222, they're open 24/7. And a specialist of poison information can help you, guide you through the process of what you're supposed to do in terms of doing things at home. And then they will also guide you about the next step, which is to seek medical attention. And many poison centers will also follow up in the emergency room to make sure the child arrived, they're getting the right recommendations and so forth. And so the first thing is just acting, either calling 911 if it's emergency, or calling your local poison center for guidance, and then take it from there, but not to ignore it and say, oh, I'll just wait till, like you mentioned, I'll just wait till it passes. Do not do that. Very
good. Now, not as many people have heard of the National Battery Ingestion Hotline. Can you tell us about that?
Sure. So the National Electronic Manufacturing Association, so many different companies that produce batteries or distribute batteries, there is another separate phone number. That is 1-800-498-8666. And this is also staffed by specialists in poison information. So either number you call, you're going to get help 24/7, 365. It's really whatever the caller can find the number fastest. Just get help, whether it's your local poison center or the battery ingestion hotline.
Very good. Thank you.
Sure.
So, are there any final thoughts that either of you would like to add before we wrap up?
I think also, in addition to kids, don't forget about your four-legged companions. We've, we had calls where dogs have swallowed batteries. The owner drops it, and if you have a lab, they're kind of like a toddler forever, and they might grab it and swallow it. And so it's not just humans that can develop toxicity; animals can too. So again, another reason to keep them out of sight, out of reach, and just be very vigilant about when you're handling batteries.
Great.
My only last comment as well too is that toddlers are great scientists, and they find great places to put them. And so even if they didn't swallow them, if they put it in their nose or they put it in their ear, that can still cause damage too. And so there still is a situation where we want you to go in, get seen as soon as possible, because that injury can happen pretty quickly. And so we want you to go to the right place to get those taken out. They're great at performing experiments, and we just would like to make sure that they are all happy holiday experiments, as opposed to the ones that get you set up for having some injury. So enjoy your holidays, be aware of where your batteries are, try and make sure that you don't have any out in the open for them to get into. And then if something happens, we are here to help you 24/7, 365. This is a free service. There is always somebody who's there. And so give us a call, and we're happy to help direct people into kind of what to do next. And then again, as Dr. Banerjee recommended, if this is somebody who's in distress, call 911 first. We can always have that conversation after the medical professionals are on the scene.
Absolutely. Thank you. The last little thing I will add is, folks, there's never any shame in calling the Poison Center. Like, I promise we've heard weirder stories than yours. There may not even have been a full exposure yet. You can still just call us to ask questions. We're never going to send you a bill. We're never going to tell anyone else who called us. Your info's safe with us, and we're just here to help. We're just here to help however we can. Well, with all of that, thank you all so much for tuning in, either live or in the recording. Please have wonderful, happy, and safe button battery ingestion-free holidays. Take care, everyone. Bye now.
Bye. Thank you.